So how good are we right now, just as it stands? Like we talked about, migraine affects up to a fifth of the population. There's more than 1 billion people with migraine in the world. And more than half of patients, there's a 5-year delay or more between the first time they manifest the migraine and when they're diagnosed. Only 30% of the people, even if you get over the hurdle of getting the diagnosis, fewer than a third actually get the medicine when they are eligible for it. And at 1 year, fewer than a fifth of those people are still taking their prophylactics more than 80% of the days. And I think that speaks to a lot of the issues that we have with the traditional medicines. So looking at those side effects like Topamax, I tell people, well, this one is a bit of a hard sell, but I love it. Topamax is probably my most commonly prescribed oral medication. The trick is going very low and very slow. You break those tablets in half to 12.5 milligrams, and you let the patient decide if they want to increase it every 1 to 2 weeks by half a tab until you reach 100. And it can take a long while to get there. Then they have to sit there for 2 to 3 months to see if it works. Doing it that way, I find patients are much better able to tolerate it. And you avoid the brain fog, the tingling paresthesias in the fingers or face. You just have to warn them about, glaucoma, kidney stones, sometimes irritability, or even up to suicidal ideation if they have a history of that typically. And of course, it carries a risk of cleft palates in women of childbearing age. So you want to make sure they have good contraception. And so for all these reasons, I think many people are hesitant to prescribe topiramate unless they feel very familiar with it, like a neurologist. But I would say with good counseling, good monitoring, it's actually a fairly safe thing in routine clinical practice. And it's now being remarketed with Phenergan as a weight loss supplement. So I think that's a little bit, some people are looking for that, especially if they have IIH kind of thing, the idiopathic intracranial hypertension. So I think it has a bit of a bad rap because of the side effects, but I think it's an oldie and a goodie.